we're going to start, and before I start, 3 चीज़ें हैं जो I really want to talk to you about. Okay, first, we read yesterday for some hours. I want to know, did you go back and revise or not? How many of you were able to do it? Second, मैंने एक homework दिया था सबको. What was that? Mind maps. A lot of you have already shown me your mind maps. अब कितने बच्चे हैं जिन्होंने बनाया था? Let's see the strength. Okay, fair enough for the first class. I have to simply motivate the others to do it as well, right? तीसरी चीज़ जो आज मैं ऐड करूँगी, और इन तीनों चीज़ों की बहुत इम्पोर्टेंस है, right? Third thing which I didn't tell you to do yesterday, but I'm going to tell it to you today, is that you have to start solving MCQs. Okay? We have to do it right from day 1. ठीक? कितने MCQs सॉल्व करेंगे? 500? 250? 150? 150? Okay? I just want to tell you that you have to start, and you have to start small. We are going to practice 50 MCQs every day. ठीक है? Every day. You may do it in one go. You may do it in 2 slots, right? ऐसा भी कर सकते हैं कि 25 morning, 25 evening, or we may do it in one go. Now, when we are saying we are going to practice 50 MCQs, how are you going to do it? That is the next question, है ना? So, we are going to solve or start solving topic-wise MCQs. So, you're going to open your DQB, और जो भी हमने पढ़ा है उस टॉपिक के मतलब corresponding topic we are going to do, and we are going to solve 50 MCQs from that topic. When you are solving those MCQs, you have to do it in a timed manner. ठीक है? हम लोग MCQ करने का तरीका भी भूल गए हैं because a lot of things are being bombarded to you, right? So हम लोग क्या करते हैं, MCQ करते हैं, फिर उसका आंसर देखते हैं, उसके नीचे 10 पेज की थ्योरी दी होती है, फिर वो रट्टा मारते हैं, and it becomes very cumbersome, and you're losing the essence of solving MCQs. Okay? MCQs करने का एक तरीका है, it has to be done in a timed manner. So if you are practicing 50 MCQs in one go, you give yourself a time limit of 30 minutes. Okay? The timer should be on 30 minutes. You'll try and solve 50 MCQs. ठीक है? और अगर 50 भी ज़्यादा लग रहे हैं, you can start with still a smaller number. Start with 30 MCQs. Okay, but you have to start. अब उसको हमने एक QA के फॉर्म में करना है, मतलब you have to commit your answers, not simply see what is given in the explanation below. Only QA solve. उसके बाद अपने MCQs को खुद चेक करना है, मतलब you are going to keep track of how many you did wrong and how many you did right. ठीक है? Now जो wrong होंगे उन MCQs में you should see the reason why you did it wrong. So one reason can be factual. It was a factual question, I didn't remember it, and I have landed up doing it wrong. Yes? Or memory based, right? Second is I didn't understand the question, or I didn't understand the topic. That could be yet another reason why you do something wrong. What is the third reason? Maybe you haven't covered that part. Maybe it was interlinked to something else and you haven't done that part right now, और वो इसीलिए गलत हो गया. So always when we are solving MCQs, we are going to categorize them in 3 parts. Memory based things, concept or application based things, and new. ठीक है? So इसकी मिलकर हम एक wrong diary बनाएंगे. So आप लोग 19 copies बनाने वाले हो, 1 for each subject, and you are going to make a 20th copy as well. Okay? What is that 20th copy? You are going to label it as your wrong diary. ठीक? Wrong diary में you will start putting topics that you have done wrong. मतलब जो हमने cover भी करे थे और आपने गलत कर दिया, वो topic का नाम या very specifically what you have done wrong वो आप mark करोगे. For example, you do a question on teratogen wrong. Okay? So you will very specifically write what you did wrong. जितना specific लिखोगे wrong diary में, उतना that diary is going to be more useful for you. Okay? I am going to tell you subsequently how we will use that wrong diary. but it is going to be something which ensures that your number of correct questions keeps improving. Yes, so हमारी बहुत आदत होती है comparison with someone else. My friend got 40 correct, I got 30 correct. Someone got 20, I am at 30. So both ways it's true, right? This is a wrong comparison, something that puts us under a lot of stress. किससे होना चाहिए comparison? From your own self. That is the only comparison you should do. If you are even 1% better than what you were yesterday, you are improving, you are on the right track. So you have to stop comparing yourself to others. You have to keep track of your correct questions. पर एक और चीज़ देखेंगे, अभी नहीं, जब आप टेस्ट देना शुरू करोगे तो आपको देखना है कि जिसने सबसे अच्छा किया उसके कितने करेक्ट क्वेश्चन थे. ठीक है, सबसे कंपैरिजन नहीं कर रहे हम, बट whoever got rank 1 in the test that I gave, how many correct questions did he or she achieve? Okay, why? मतलब उतना गैप है हमारे में, right? That is the scope that we also can improve. Yes, so you should know कि okay यार, the topper or someone who's done way better has got 60 correct, I scored 40. So this is the gap I have to bridge. So any amount that you improve from here is going to fetch you a better position. And I know when we talk about positions and ranks and people tell you ये rat race है, हम आपको गलत चीज़ सिखा रहे हैं, but वो क्यों ज़रूरी है? क्यों ज़रूरी है? Because this is how you open up your opportunities in life. Okay? So when you are doing something, you have to understand you are doing it so that you have more opportunities in your life. Anyways, you're going to pass MBBS, you're going to be doctors, you're going to still make a difference in people's life. It's not that you will not. But when you go ahead of that, you are just improving the opportunities that will come your way. Right? सो इसीलिए हमने ये एक ट्रैक रखना है कि कितना बेहतर और हो सकता था. ऑल्सो बिकॉज अ टेस्ट पेपर कैन हैव डिफरेंट लेवल ऑफ डिफिकल्टी. सो समटाइम्स यू गेट वेरी डिसहार्टेंड, ओ गॉड आई हैव स्कोर्ड ओनली 20 करेक्ट. सो देन इफ यू से यार कि टॉपर के भी 35 ही हुए हैं, देन यू अंडरस्टैंड ओके प्रॉब्ली द डिफिकल्टी लेवल इटसेल्फ वाज हायर, बिकॉज यू शुड नॉट बी डीमोटिवेटेड टू प्रैक्टिस क्वेश्चंस. ठीक है, सो MCQs 3 चीज़ों में करेंगे. नंबर 1, टाइम्ड मैनर इन द फॉर्म ऑफ टेस्टिंग योर ओन सेल्फ. नंबर 2, analysis. If you are practicing MCQs and you're not analyzing, those MCQs are of no use. Okay, believe me. So if somebody tells you you should practice 10,000 MCQs, it's absolutely futile if you're not analyzing. Somebody who's practicing only 100 MCQs and they're analyzing will do far better than you. Unless yes, time management is your concern. तो yes, उसमें ज़्यादा हेल्प करता है. But other than that, analysis is the more important part of your workup. ठीक है, so 20th कॉपी आज से बनेगी. ठीक है, और उस कॉपी में टॉपिक्स जाएंगे. ऐसा नहीं हो सकता कि आपका कोई टॉपिक उसमें ना जा रहा हो. अगर नहीं जा रहा है तो 2 ही रीज़न है, either you're not doing it or you don't care, and both the things are going to be not good for you, right? So 20th कॉपी बनेगी और अब माइंड मैप के साथ 20th कॉपी भी चेक होगी. ठीक है, वो भी चेक होगी, वो बनाओगे, उसको बेशक 19 पार्ट्स में डिवाइड कर लो एंड यू कैन स्टार्ट पुटिंग ऑल सब्जेक्ट्स देयर एंड यू जस्ट हैव टू राइट व्हाट यू आर डूइंग रॉन्ग. आफ्टर 2 or 3 classes, I will tell you what are we going to do with this 20th copy. Okay, we will see how we are going to utilize it, how we are going to improve. Now any exam, especially जो हमारे entrance exams हैं, there are 3 aspects of preparation. What are the 3 aspects? The first is theory or content building. What is the second aspect? MCQ practice, because that is the format in which the exam is going to come. What is the third? Revision. Yes? So these are the 3 things and we have to inculcate the habit of doing all 3 together. कुछ लोगों को ऐसा लगता है रिविजन तब करते हैं जब सब कुछ हो जाता है, तो सब कुछ मेडिकल साइंस में होना बड़ा मुश्किल है. सो बाय द टाइम वी स्टार्ट रिविजन वी आर ऑलरेडी लेट. yes, and you can't consolidate things. इसलिए मैं आपको consolidation साथ साथ ही सिखा रही हूँ. So mind map is nothing but consolidating. Yes. So content we are taking care. That is our responsibility, that we give you a content which is good enough for preparation of your exams of any sort. Yes. Revision is an art. It has to be started side by side. Which is why I am making you do two things. One is mind map. The other is wrong diary. It has to be there. Okay? So wrong diary has to be there. Your mind maps have to be there. Yes. Third is MCQ, which is what you're going to start now. Yes. So are you all going to promise that you're going to do it? No, this is not a convincing promise. It isn't. So you have to promise, and you have to be loud enough for that. Say it. Why not say it? Because when you're saying it loud, you're committing it to yourself. Okay? Little promises, you have to learn to start keeping them. बचकानी बातें लगती हैं, but they go a very long way. Yes? There are some promises that you have to make to yourself, and you have to keep them. Okay? You think of keeping promises to others, which is again useless. You have to keep promises to yourself. Okay? So do this. Start right away. 50 MCQs is what I want you to do. It is a number that we faculty feel if you do it over a period of time, it is going to take you a long way. You can start with 30. But then there is a game we will play. What is the game? Suppose you decide, no, I'll practice only 30. Fine. For next 7 days, you will practice 30 MCQs every day, and you're going to maintain this streak. Okay? If you maintain this streak, week 2, your number increases. So next week, you have to do 40 MCQs every single day until you reach the streak of 50. जब 50 नहीं हुआ तो वापस हमने कम से शुरू करना, छोड़ना नहीं है. So you have to maintain some level. So हम ना all out जाना चाहते हैं, या तो मैं हज़ारों करूँगा या मैं करूँगा ही नहीं, है ना? So you have to learn that momentum धीरे धीरे बनता है. It is not going to happen in one day. So you have to train your body, you have to train your mind to develop that momentum. Okay? So we'll start with some number, we'll maintain a streak, we'll increase the number till we reach 50 MCQs. Right? Chalo. So this is what I want you to do, and you will do it. Okay? And as I said, next class I will definitely check the mind maps, but उसके अगली वाली class I'll start checking the wrong diary as well. Yes? So please make it, because I have to teach you how to make it. If you don't make it properly, आप बहुत बह जाओगे और काम कभी ख़त्म नहीं होगा. Okay? So for example, अगर हमने लिख लिया PPH पढ़ाया मैंने, आपने जाके 2, 3 या 4 क्वेश्चन गलत कर दिए, और अगर आपने रॉन्ग डायरी में PPH लिख दिया, then it's a waste. Because if you write it like that, you're telling yourself you have to read the entire topic again. It will take you the same amount of time like it did in the first reading. You will still read the same things which you did in the first reading, and you will still make the same mistakes. Which means you're only increasing your workload without improving efficiency. Smart study is what we all have to learn. Unlike others who might tell you doctors have to slog, please understand, each one of you is a very, very bright student. You've been at the top wherever you have come from. There is no doubt on your calibers. Anybody who doubts on your caliber is actually very stupid. So we don't have any doubt on your caliber. Neither we have doubt on your hard work. आज या कल कर लेते हो. You may get distracted for a little while, and then I know you're going to come back. But the problem is not caliber, and the problem is not hard work, because that's plenty here. What is the problem? Smart study. The only difference that is going to create a difference in your ranks eventually is smart study. Do you know how to do it efficiently or not? And this is something which will be useful in your post-graduation as well. You have to learn to work smart so that your efficiency improves. Yes? So we have to learn that art as well. But smart study बाद में आता है, पहले content building आता है, फिर smart study करेंगे. But उसकी तैयारी साथ साथ करेंगे.